General principles of pharmacology. Characteristics of drug. In an individual, the pharmacokinetic and pharmacodynamic parameters vary from drug to drug. One drug is well absorbed, another drug is partially absorbed, whereas some drugs are not absorbed at all. One drug produces a response whereas another drug does not. These variations are due to some particular features of a drug such as molecular weight and size, stereoisomer, structure-activity relationship, ionization constant, partition coefficient, dosage form, salt preparation, affinity to bind with plasma proteins, receptors, and others, and potency. Molecular weight and size. The molecular weight of a drug is one of the factors responsible to penetrate the biological barrier. The majority of drugs have a molecular weight within 100 to 1000. The drug with relatively low molecular weight, between 100 to 150, crosses through very small pores of the epithelial lining of the body surface, cornea, gut, and urinary bladder very easily. For example, ethanol 46 or nitrous oxide 44 can easily pass through the epithelial lining. Insulin about 5,800, dextran 40,000, and steroids are examples of high molecular weight substances and cannot easily pass through the epithelial lining. The drug with a molecular weight of less than 600 enters from the mother's blood to fetal circulation via the placenta. Most of the drug molecules are small in size, 5 to 10 angstrom long. The change in the size of drug particles, for example, griseofulvin, digoxin, phenacetine, influences their absorption from the gastrointestinal tract. For example, microsized griseofulvin is absorbed twice as well as with normal particles. In addition, ultramicrosized particle is absorbed twice as well as the microsized particle. In general, the smaller the particle size of the drug, the greater is the absorption. Another drug tolbutamide can be formulated with a particle size that dissolves slowly. Thus, the gradual release of the drug in the gut is maintained for a longer period. Stereoisomer. Many synthetically manufactured compounds exist in different stereoisomeric forms. Geometric, or cis-trans isomers and diastereoisomers are both chemically and pharmacologically distinct. They are readily separable and are treated as different compounds in the drug development program. Mirror image enantiomers plus, or, form, in contrast, differ physically only in their optical properties rotation and, except in a biological system or chiral environment in which only one of the enantiomers is recognized, which is chemically identical to the biological system. Until recently, it was impractical to separate optical enantiomers on a commercial scale. Such compounds were consequently developed for therapeutic uses as one-to-one racemate without studying or characterizing the properties of each enantiomer, even though it was recognized that two components might have different pharmacokinetic properties and qualitatively or quantitatively different pharmacological or toxicological effects. In instances in which two components of a racemate have been studied separately, differences in pharmacokinetic and pharmacodynamic properties have frequently been found. Differences in therapeutic effects are unpredictable. Sometimes they are negligible. Isometric one of the enantiomers is biologically inactive, as is the case with propranolol. Sometimes two have different pharmacological properties, plus, sotalol is antidesrhythmic, while sotalol is a beta-adrenoceptor antagonist, and most importantly in a clinical context, one enantiomer may be toxic within the therapeutic dosage range, as is the case with thalidomide, levamisole, and carnitine. The adrenaline possesses greater potency than the plus form. The structure is the same but the only difference is at the location of O group at beta-carbon position. The O of adrenaline lying downwards interacts with the receptor site of the enzyme and as a result, this stereoisomeric form is more potent 10 times than the plus form of the drug. Chloramphenicol possessing two asymmetric carbon atoms has 4 stereoisomers but only the D-threochloramphenicol has antibacterial activity. The plus amphetamine is 3 to 4 times more potent than the form in excitation of the CNS. But dobutamine is a potent agonist at a adrenoceptor. On the other hand, plus dobutamine is a potent alpha adrenoceptor antagonist that blocks the effects of dobutamine. Structure-activity relationship. The study of the variation of drug effects about its chemical structure is termed structure-activity relationship. The new drug, thus, produced has advantages over the previous one in various aspects of pharmacokinetic and pharmacodynamic. The absorption of a drug can be altered by changing the structure of a drug molecule. For example, only 30% of chlortetracycline is absorbed from the gastrointestinal tract. But the catalytic removal of chlorine from chlortetracycline gives tetracycline, about 60 to 80% of which is absorbed after oral administration. The structure of a drug molecule influences its biotransformation caused by enzymes. For example, acetylcholine is rapidly metabolized by the enzyme cholinesterase. An addition of a methyl group to the carbon adjacent to the ester oxygen, in the case of methacholine, causes hydrolysis at a considerably slower rate. The substitution of an amine group at the terminal of acetylcholine, in the case of carbachol, makes the drug resistant to hydrolysis by cholinesterase. Catechol O-methyltransferase (COMT) is specific for catechol ring. The sympathomimetic drug will not be metabolized by COMT if the drug is devoid of hydroxy group at either 3 or 4 position of the benzene ring, for example, ephedrine, amphetamine. So, the half-life of that drug will be longer. The effectiveness and duration of action are enhanced. The presence of a methyl group at the alpha carbon of the side chain reduces the metabolism of the sympathomimetic drug by monoamine oxidase (MAO). Directly or indirectly acting nature of a sympathomimetic drug on adrenoceptor depends on the structure of the drug molecule. The substitution at the 3 and 4 positions of the benzene ring by hydroxy or methoxy OC group and a hydroxy group at the P carbon causes the drug to act directly on the adrenergic receptor. Adrenaline is a directly acting sympathomimetic drug. Drugs that have only one substitution or no substitution at these positions will be indirectly acting. Amphetamine is an example of the latter group. Most of the clinically important beta-adrenergic receptor antagonists have an oxymethylene bridge 0CH2 between the aromatic nucleus and the ethanolamine side chain. This oxymethylene bridge attached to the benzene ring converts the drug into an antagonist. Ionization constant pKa. Most of the drugs are organic compounds. Unlike inorganic compounds, organic drugs are not completely ionized in the fluid. These are weak acids or bases. For example, hydrochloric acid is a strong acid because it is completely dissociated into hydrogen ion Ft and chloride ion Cf Ft plus C greater than HCl, a strong acid, whereas a fraction of an acidic drug is present in undissociated form Ha and ionized form, both A and H+. Ha H plus A H plus is the cation, A is the anion, B plus H plus, BH plus B is the non-ionized base. Here both indicate reversibility of the process. The acidic drugs are ampicillin, aspirin, disodium chromoglycate, furosemide, phenobarbital, and sulfonamides. The basic drugs are allopurinol, amphetamine, chlorpromazine, imipramine, morphine, and propranolol. Ethanol is an example of a neutral drug. The extent to which a drug molecule in solution behaves as an acid or a base depends not only on its nature but also on the local hydrogen ion concentration. The concentration of hydrogen ion in different body fluids varies. For example, the pH of the plasma ranges from 7.35 to 7.45. But the fluid in the gastrointestinal tract has a wide range of pH. Within the stomach, it is from 1.0 to 3.0. The pH of the intestinal fluids is alkaline. On the other hand, the pH of the urine is between 4.6 to 8.0. It can be readily appreciated that the degree of ionization of a given compound may vary considerably at different biologic barriers or particular barriers under different conditions of pH. The Ka of a molecule is a measure of its strength as an acid. The pKa is the negative logarithm of the Ka, just like pH. The pKa of a drug is the pH at which the concentration of ionized and non-ionized forms are equal. The word of pKa comes from the term acid. Here, the law of mass action can be applicable, and it should be possible to change the fraction of ionized or non-ionized materials present in the solution by changing the hydrogen ion concentration. According to the law of mass action, when a chemical reaction reaches equilibrium at a constant temperature, the product of the active masses on one side of the chemical equation when divided by the product of the active masses on the other side of the equation, is a constant regardless of the amount of each substance present at the beginning of the action. The Henderson-Hasselbalch equation stated for acidic drug, Ha, non-ionized form, log equals pKa, pHa, anionic form, from the above equation, the following form may be used, non-ionized form, pKa, pH equals log, anionic form, multiplying both sides by -1, we get non-ionized form, pKa plus pH equals log, anionic form, non-ionized form, A, Ha, pH equals pK plus log when A equals Ha, then pH equals pKa for a weak base, B, pH equals pKa plus log BH plus. Thus, the higher the pH, for example, more alkaline solution, the higher is the ionization, and conversely, the higher is pKa the lower is the tendency to ionize. We can easily calculate the proportion of non-ionized molecules by the pH value of the medium and pKa of the drug. Now the question is how you will calculate the percentage of the non-ionized and ionized fraction of drug when the pKa of a drug and pH of the surrounding fluid is known. Ionization of an acidic or basic drug can be calculated using the following formula: 100% ionized drug equals, for an acidic drug, 1 plus 10 pKa pH, 100% ionized drug equals, for a basic drug, 1 plus 10 pH, pKa. The ionization constant affects the extent of absorption, excretion, and nature of the distribution. For example, ephedrine has a pKa value of 9.6. In gastric pH, most of the ephedrine is in ionized form. So, the extent of absorption from the stomach is negligible. On the other hand, the amount of non-ionized form of aspirin, pKa is 3.5, is increased and readily absorbed from the stomach. The percentage of the non-ionized form of aspirin is decreased with increasing the pH of the surrounding fluid. Streptomycin is fully ionized and is not absorbed from the gastrointestinal tract. Partition coefficient. The movement of drugs through the biological membrane depends on the partition coefficient. It may be expressed as lipid-water partition coefficient, as the main component of the biological membrane is the lipid and the water is in the extra and intracellular space, chloroform, water partition coefficient, or blood-gas partition coefficient, considering them entering from the lung to blood and vice versa. Lipid-water partition coefficient. lipid-water partition coefficient means the relative solubility of a drug in lipid as compared to water and can be measured as the ratio of the concentration of drug in two immiscible phases, lipid representing the membrane and the water representing the plasma. Lipid, water partition coefficient K, can be expressed as K equals company, CW, where county is the total concentration of drugs, both ionized and non-ionized forms, in the organic phase, and CW is the total concentration of drugs in the aqueous phase. O stands for organic and W for water. Urea has a low lipid-water partition coefficient of 0.0016, 1 to 6,250. Inorganic ions are not soluble in lipid, so their lipid-water partition coefficient can be considered as near zero. The higher the lipid-water partition coefficient, the higher is the affinity for the cell membrane and the more rapidly the drug crosses the membrane. There is a linear relationship of the partition coefficient of drug and drug absorption. Phenobarbital has a high lipid-water partition coefficient of 5.9. Thiopentoin sodium has a chloroform water partition coefficient of about 100, so is highly soluble in lipid. The relatively high lipid solubility of thiopentoin mainly reflects the presence of S equals C moiety. Hexamethonium has a chloroform water partition coefficient of 0. This drug is used for the treatment of hypertension and is administered only by injection because it is not absorbed from the gastrointestinal tract. The lipid-water partition coefficient of a drug can be changed. When the polarity of a drug is increased either by increasing its degree of ionization or by adding a carboxyl COOH, amino NH, or hydroxyl O group to the drug molecule, then the lipid-water partition coefficient of that drug will be decreased. On the other hand, when the polarity of a drug is decreased either by decreasing its degree of ionization or by adding phenyl or butyl group, the lipid-water partition coefficient will be increased. The addition of two hydroxyl groups in estrone results in a 45-fold decrease in lipid-water partition coefficient, so there is a decrease in coefficient of estriol when compared to estrone. Blood-gas partition coefficient. The blood-gas partition coefficient indicates the relative solubility or affinity of an anesthetic for blood compared to air. The blood-gas partition coefficient for nitrous oxide, halothane, and methoxyflurane are 0.47, 2.3, and 12.0 respectively. The value for nitrous oxide is very low, which means that 1 volume of nitrous oxide will be dissolved in blood for every 2 volumes in the alveolus. Its low solubility in the blood causes rapid equilibrium with the brain and faster induction of anesthesia. On the other hand, ether has a high blood-gas partition coefficient, that is 12 volumes of it will be dissolved in blood for every volume in the alveolus. The high solubility of ether within the blood makes the induction and emergence slow. Only 20% of the equilibrium concentration occurs even after 40 minutes. Dosage form. Pharmaceutical companies dispense a drug in a variety of formulations suitable for single or multiple routes of administration. Some antibiotics are available in tablet, capsule, or suspension form for oral administration. So, it is the doctor who has to choose the formulation suitable for the patient.
It is important because it influences the bioavailability of the drug.
For example, digoxin when injected intravenously, the bioavailability drug is 1.00. But when the same amount of the drug is administered into the body by oral route in tablet form, the bioavailability is about 0.62. On the other hand, the bioavailability of digoxin elixir administered orally is 0.80. When the tablet form of a drug is swallowed, it is necessary to disintegrate as well as dissolve before absorption. But in the case of the capsule, there is no question of disintegration. Only dissolution is necessary. In case of suspension, there is no disintegration or dissolution. So, the rate of absorption is greater from suspension than from a capsule or tablet. Salt preparation. All drugs are not soluble in water. For example, streptomycin is water-soluble whereas diazepam is lipid-soluble, not water-soluble. The nature of solubility of a drug can be changed by adding salt. Theophylline alone is insoluble in water. But when ethylene diamine hydrochloride is added to theophylline, the mixture is known as aminophyllin. Aminophyllin is water-soluble. Water solubility makes aminophyllin suitable for intravenous administration. In addition to aminophyllin, there are several salt preparations of theophylline, choline theophylline, theophylline glycinate. 80% of the total weight of aminophyllin is theophylline, whereas 45% of the total weight of theophylline sodium glycinate is theophylline. Another example is morphine. Morphine sulfate is preferred to morphine because it is much more water-soluble. Methyl-dopa is poorly soluble in water and can only be administered orally. On the other hand, methidopate is the ethyl ester of methyl-dopa and is available as the hydrochloride salt. Methyldopate hydrochloride is soluble in water and is suitable for intravenous administration. The reason for the solubility of salt in water is that salt is an ionic compound, and that is why it is soluble in a polar solvent, water. Erythromycin base has a bitter taste. This bitter taste can be overcome by using erythromycin ethyl succinate. Affinity to bind. Usually, a drug has the affinity to bind with food particles, other drugs, plasma protein, erythrocyte, specific receptor, or tissue. The binding of a drug with its specific receptor usually produces responses, whereas the binding with plasma protein or tissue does not produce any response, instead acts as a storage site. Affinity to bind with food particles or other drugs. Some drugs such as tetracyclines, iron, calcium, aluminum hydroxide bind with food particles or other drugs. This binding alters the absorption of the drug from the gastrointestinal tract. Thus, the drug that is taken orally on an empty stomach shows better absorption. However, the absorption of griseofulvin is better with a fatty diet. Affinity to bind with plasma protein. After entering into the systemic circulation, most drugs bind to plasma proteins, mainly albumin. Each albumin molecule has more than one site to which a drug may bind. At pH 7.4, albumin has a negative charge and has a high capacity but low affinity for binding cationic drugs. Molecules of one drug may bind to more than one site on each albumin molecule, and the difference may not have the same affinity for the drug molecule. While considering the binding of the drug to plasma proteins, it is found that acidic drug principally binds to albumin while basic drug binds to alpha-1 acid glycoprotein. The affinity of a drug for plasma proteins may be altered in disease conditions such as chronic renal failure. In this condition, the accumulated compounds that are not significantly removed from the body by dialysis displace acidic drugs from the albumin binding sites. Affinity to bind with specific receptor. Many drugs have the affinity to bind with their specific receptors. When a drug D binds with receptor R, a drug-receptor complex (DOCTR) is formed. The rate at which a drug molecule combines with its specific receptor is the association constant K2. Similarly, the rate at which the drug-receptor complex splits apart is the dissociation constant K2. The tendency of a drug to form a complex with a receptor and subsequently maintain it is the affinity. It can be quantitatively expressed as K1, K2D plus R equals DOCTR. The affinity of a drug to different subtypes of receptors varies. For example, prazosin has a 1,000-fold greater affinity to alpha-1 adrenergic receptor than that to alpha-2 adrenergic receptor. On the other hand, propranolol has an equal affinity for both adrenergic receptors. Affinity to bind with tissue. Drugs from the systemic circulation will be distributed and accumulated into some tissues. The presence of some drugs in some tissues is due to their affinity to bind with those tissues. For example, tetracyclines are accumulated in the bones, chloroquine is accumulated in the retina, etc. Potency. A symptom or disease can be treated by more than one drug. In that case, it is necessary to consider which one is more potent. The potent drug acts at lower concentrations and the log dose response curve is shifted to the left. Several drugs such as morphine, pethidine, butorphanol, hydromorphone, and fentanyl are used to relieve pain. If we consider the unit of morphine as 1, then butorphanol is 5 times more potent than morphine. That is, to relieve pain 10 of morphine is usually administered. To get the same analgesic effect, 2 mg of butorphanol is used. Pethidine is 10 times less potent than morphine. Intravenous injection of either noradrenaline or angiotensin II causes an increase in both systolic and diastolic blood pressure. Angiotensin II is 40 times more potent than noradrenaline. Potency is a comparative rather than an absolute expression of drug activity.
It is in no way relative
to its value, efficacy, or safety. The least potent drug among agents with similar effects may be no less effective than the most potent one as long as each agent is employed in its appropriate dosage. Individual variations in response to drug. Different individuals, given the same drug, show a wide variation of response ranging from no detectable change to grossly excessive reactions of various kinds. These variations are due to age, sex, body weight, surface area, nutrition, alcohol, cigarette smoking, pregnancy, genetic factor, environment, and pathological conditions. Age. The kinetics of drugs are changed with age. Neonates, infants, children, and older people are more sensitive to the effects of any drug than adults. The absorption of the drug from the gastrointestinal tract is slower in neonates than in older children. The use of soap containing hexachlorophene causes more neurological damage in premature infants, due to its ready penetrability, than in adults. The binding of the drug with plasma protein is decreased both in neonates and infants. Premature neonates and infants are less capable of metabolizing drugs than adult patients. The enzyme responsible for the metabolism of the drug is poorly developed in patients of these age groups. However, there are some drugs, phenytoin, carbamazepine, chlorpromazine, ethosuximide, and phenobarbital, which are given in higher doses to children than to adults. This is due to an increased rate of metabolism of these drugs in this age group. In neonates, especially premature ones, chloramphenicol may cause cyanosis, abdominal distension, vomiting, and loose green-colored stool, gray baby syndrome that is due to inability to metabolize the drug as a result of glucuronyl transferase deficiency. The deficient glucuronidation of most drugs is compensated by the early development of sulfate conjugation. This can be represented by a study showing that paracetamol is predominantly excreted as sulfate conjugate in neonates and only to a minor degree as the glucuronide, whereas the proportion between these metabolites is reversed in adults. The rate of excretion of the drug in the infant may be altered due to poor renal function. For example, the elimination half-life of theophylline is 3 to 5 hours in children and 20 to 30 hours in premature neonates. The half-life of the elimination of diazepam increases with age. This increase is about 1 hour per year of life. Diazepam clearance is, however, not age-related, since lengthening of the half-life occurs as a result of an increased distribution volume. Older people show decreased function as well as circulatory impairment of the liver and kidneys. So, these factors can modify the absorption, distribution, biotransformation, and excretion of the drug. The dose of many drugs should be reduced when administered, particularly by injection. Streptomycin undergoes less biotransformation in older people, resulting in adverse effects with conventional dosage. When swallowed, a drug may be absorbed less completely or more slowly due to reduction of available absorptive surfaces, splanchnic blood flow, or altered gastrointestinal motility. The first-pass biotransformation is decreased in older people, resulting in increased systemic availability. There is a reduction in muscle mass and qualitative change in drug binding sites. The plasma half-life of benzylpenicillin is 20 minutes in an adult of 20 years, and this is increased to 40 minutes at 65 years. Children may react qualitatively differently to some drugs. For example, barbiturates frequently produce excitement rather than depression. Young babies are relatively more sensitive to the respiratory depressive effect of morphine than are older children or adults. Sex. In comparison to M.N., some women may show increased sensitivity to certain drugs. This may be due to hormonal effects. Males have higher mixed-function oxidase activity than females because testosterone induces microsomal enzymes, whereas estradiol decreases their activity. In the adult female, the amount of adipose tissue is usually greater and there is an increased chance of accumulation of the drug in that tissue. The mean half-life of antipyrine is 10.3 plus or minus 2.1 hours in women and 13.4 plus or minus 3.7 hours in men. Body weight and surface area. The amount of drug requires to produce a therapeutic effect should be adjusted in proportion to the body weight or surface area. The greater the body weight or surface area, the more the drug becomes diluted in the body. The dose of a drug should not be the same in a thin and fat. Female has relatively low body weight and thus requires a smaller dose. One should be careful about the doses of drugs having a low margin of safety: digoxin, gentamicin, aminophylline. Nutrition. Malnutrition impairs the biotransformation of the drug. It includes the deficiency of protein, fat, vitamin A, riboflavin, and ascorbic acid. The rate of biotransformation of theophylline can be prolonged twofold as the intake of the percentage of total calories represented by carbohydrate doubled from 35 to 70 and the percentage of protein decreased from 44 to 10. Experimentally produced scurvy in guinea pigs impairs the biotransformation of several drugs. Some vegetables such as cabbage, cauliflower stimulate the intestinal biotransformation of some drugs. Alcohol. Intake of alcohol alters the biotransformation of the drug. Acute intake of alcohol inhibits the biotransformation, whereas chronic alcohol intake increases the biotransformation. The plasma half-life of tolbutamide is 5.9 hours in the case of a non-alcoholic person, and this is decreased to 2.7 hours in a chronic alcoholic. Increased biotransformation of the drug in chronic alcoholic is due to increased hepatic microsomal cytochrome P450, and proliferation of the smooth endoplasmic reticulum. Cigarette smoking. The biotransformation of some drugs such as theophylline, caffeine, and imipramine are several times higher in cigarette smokers than in non-smokers. Cigarette smoke is a rich source of benzopyrene, which is a potent enzyme inducer. There is a 12-fold increase in pulmonary monooxygenase activity after continuous exposure of rats to a mixture of cigarette smoke and air for 5 hours daily for 3 days. The elimination half-life of theophylline is about 8 hours in adult non-smokers and about 4 hours in adult smokers. Pregnancy. During pregnancy, one should not use any drug. If it is essential to maintain pregnancy, then it should be used cautiously. Most birth defects occur during the first 3 months of pregnancy, often before a woman even knows she is pregnant. One should be kept in mind that the absorption of the drug is not decreased during pregnancy. Total phenytoin concentration in plasma falls during pregnancy because of decreased albumin binding, the biotransformation of the drug may be altered. For example, demethylation of pethidine is reduced in pregnancy. The elimination of phenobarbital and digoxin is increased, which is due to an increase in glomerular filtration rate. Genetic factor. The population can be seen to consist of a bimodal distribution of rapid and slow acetylator based on their ability to bio-transform isoniazid. The population of rapid acetylator metabolizes isoniazid, half-life of about 1 hour, to acetylisoniazid, which is excreted in the urine. Slow acetylator metabolizes isoniazid at a slower rate, half-life of 4 to 5 hours, and is subjected to isoniazid toxicity such as peripheral neuropathy, while rapid acetylator needs more drugs to get a therapeutic effect. An increased chance of developing peripheral neuropathy is due to the increased accumulation of metabolites of isoniazid. Environment. In an urban area, the atmosphere is polluted with hydrocarbon. There is more fresh air in the rural area. This hydrocarbon affects drug metabolism as well as drug effects. Pathological conditions. Some antimicrobial agents penetrate the cerebrospinal fluid well across normal meningitis, while other antimicrobials penetrate well only when the meninges are inflamed, meningitis. For example, sulfonamides, metronidazole, chloramphenicol, isoniazid, and rifampicin penetrate well through the normal meninges. Other antimicrobial agents such as benzylpenicillin, ampicillin, tetracyclines, streptomycin, gentamicin, and cephalosporin penetrate only when the meninges are inflamed. Acute or chronic liver diseases markedly modify the rate and extent of the biotransformation of the drug. There is depression of glucuronic acid conjugation. The half-life of chlordiazepoxide or diazepam in patients with liver cirrhosis is greatly increased with a corresponding prolongation of their effects. Cardiac diseases by limiting blood flow to the liver may impair the disposition of those drugs whose biotransformation is flow-limited, for example, imipramine, isoniazid, lignocaine, morphine, and propranolol. Similarly, renal and pulmonary diseases may modify the biotransformation of some drugs like insulin or isoprenolone. Excretion of the drug is impaired in chronic renal disease.